Hey everyone, what's up? My name is Logan Lynch. I am a student physical therapist currently on my second clinical rotation before graduation, and I'm located in Lincoln, Nebraska right now. And I had planned on doing a video last week talking about my first week at my clinical rotation. But life got away from me and I had too many things planned and it just didn't happen. So I thought maybe I would go in 2-week increments and talk about my experience on my clinical and kind of the feelings I have and how the weeks are going, and hopefully spread this to other physical therapy students. And I'll talk about kind of what has worked for me and little tips and tricks, to make the most out of your clinical experience and to make sure that you are developing not only into an awesome clinician, but just a great human who is going to be great at their job and great at listening to patients and understanding what they're going through and being empathetic to that and knowing how to work with them to treat their condition and build that trust in that relationship. So I wanted to talk and tell you guys just to bring you along the journey with me of physical therapy school. I know I've been sharing it for a while, like on my Instagram, but I haven't really been talking a lot about my experiences in the clinic. And so that's why I wanted to do this for my second and my last clinical rotation, because I didn't do it for my first one, but that's okay. So my first 2 weeks, so I'll talk about kind of last week first. So my first week, I always get a little bit nervous going into my clinical experiences because you're starting something new and you don't know your CI yet, and CI stands for clinical instructor, and you haven't met them yet, and so you don't know what they're going to be like. Are they going to be really nice? Are they going to be a hard ass? Like, are you guys going to click, or are you going to have very different personalities? How fast are they going to move you through everything? So it's just kind of a nerve-wracking feeling going into something new, but also exciting, because I accept and embrace change and new opportunities and all that. So, but I was a little nervous like going into this one, especially because I had such an awesome time on my last one, and my CI and I were very close and became good friends. And so, I just wasn't sure how that relationship was going to be at this one. So that was where my thoughts going into it. And then it's a whole new setting. So I'm in an outpatient neuro setting, and it's totally, it's a new population compared to the orthopedic setting where I was seeing a lot of knee surgeries and shoulder pain and knee pain and ankle surgery, things like that, broken foot. So a lot of orthopedic and sports injuries. And then this is more neuro, so Parkinson's and stroke, and a lot of traumatic brain injury at the location that I'm at. So just a different population, and being able to be to come up with treatment plans and kind of flipping my mindset a little bit as far as how I'm going to treat the patients. So going to in my first week, it was a lot of meeting everybody and finding where things are, getting a tour of the facility, knowing where to find TheraBand and where to find canes and walkers and foam pads, and learning how to work the machines and the different, because there's a lot of different machines as far as like technological advances to help with various balance things or walking, just depending. And so learning where those are, what they do, how to work them. So my first week was a lot of learning new information and trying to create relationships and meeting the patients. And so the first week is always a little exhausting, and I didn't do a lot of treating. It was a lot of shadowing and kind of watching and learning, but I'm always surprised at like how exhausted I am at the end of the day, because I'm like, I literally was like, I didn't treat any patients, I was watching and just like talking all day, but your brain, like, nothing is a habit yet. And so when you don't have a habit, then your brain has to work harder to try and like think through things. And so I was meeting a lot of people, I was learning a lot of new things, I was trying to remember things. And so by the end of the week, I was pretty exhausted, even though I felt like I hadn't treated a lot of people. But it was a good first week, and I really liked my clinical instructor, and the place that I'm at is just very reputable, and everyone is really, they're great people, and the patients have nothing but good things to say about the people that work there. So it was cool to hear from the patients, talking about how lucky I am to be with this person or to be at this facility. So yeah, it was cool. And so meeting the patients was awesome too, because that's my favorite part, is creating those relationships and developing that rapport with patients. So that was kind of the gist of the first week. I was trying to watch and see kind of where the patients are at with the progression of their therapy, so that when I jump in, I kind of know where we're going. And that's how my clinical instructor has kind of structured it, is like, I don't take on a patient on my own until I've met them before. So if we have a new patient coming in and I haven't seen them yet, it's kind of hard to jump in the middle and create and do something with them without having a lot of information about what their goals are. And I can look at all the documentation, but it's still a different thing. It's very different looking at a piece of paper or a note on the computer and seeing where they are with their progression, what their goals are, and actually seeing them in person, understanding and seeing what their deficits are, what their impairments are, and what they're like as a person. How do you want to approach these different things? So that's how we've been doing it, is once I kind of know a patient and feel comfortable with them, then this week, that kind of leads me into this week. This week I did a lot more treating. So my clinical instructor is always right there for the patients that I see, and that's how they do it at my facility. Is I'm never completely independent with a patient, because I'm still a student, and they really take advantage of the learning part of it, and that's really, really important. So she's always right there, but what I love about mine is she kind of lets me do my thing, and then we'll go over what I have planned for a treatment session beforehand, and then afterwards we'll kind of talk, and she'll give me feedback, or we'll talk about how we think it went. But she doesn't jump in a lot in the middle of it, which I like, because it gives me more independence to kind of think through things and to practice like I am actually a physical therapist making this plan on my own, because I actually am, and then she just gives me feedback later. So it's been really good so far, and this week I've been treating a lot more patients. I've probably been doing between an average of like 4 or 5 sessions per day, and each session is, some of them are a half hour and some of them are an hour. So how many hours I'm treating changes every day, just depending on the patient and how long we're seeing them. But that's kind of how the progression goes, is I'm building up the volume of patients that I'm seeing, and a big part of this population, with the neuro population, is going to be educating myself on a lot of different diagnoses that come in, so that when I see these patients, I'm better able to educate them, because that is a huge part of the physical therapy profession, is education. And your patients, my patients, aren't going to fully understand their healing and their treatment, or they're not going to fully understand how to take care of their condition if they don't know anything about it. And so I have a job to educate my patients on a little bit more about their diagnosis, what it's going to look like as far as physical therapy, what their progression is going to look like, what they can expect to be able to do or not do, and things like that. That's a huge part, and I think that that's a major focus of physical therapy school, is that we practice and talk a lot about how to educate our patients, because there is a lot of things that people in the general public don't know about their body, or about injury and pain and healing, and it's our job to help educate in a way that they can understand, and not using medical jargon and just throwing diagnoses, throwing big words at people and expecting them to understand. That doesn't help anybody. So patient education is a huge part of it, and so that's what my clinical instructor and I have talked about kind of going forward. She gave me feedback this past week that I'm doing really well, and that I'm taking on a bigger volume of patients, which is a little bit more than what some other students have done at this point, so that made me feel good. I'm only comparing myself to me, but I mean, she had used that comparison, so in a way it kind of made me feel good about okay, I am on track, because it's really easy as a student to feel like you're not doing enough, and you're always, a lot of my thoughts during the first week was, am I doing enough? Am I jumping in enough? Should I be talking more? Should I be contributing more? Should I be asking more questions? But then to have your clinical instructor at the end of the week kind of say like you're asking great questions and you are confident with your treatment sessions, it's awesome because, you know, that is one thing that I try and do is to try and be as confident as possible. As a student, you're not going to know everything. I don't know everything. As a therapist, like therapists don't know everything. But if you go in with confidence and you ask the right questions and you just do your best with that patient, they're probably going to benefit in some way. If it's not the most perfect treatment session, that's okay. You talk with your instructor afterwards and you learn from it and figure out how to approach it the next time. But so often I feel like students, like we feel like we're not doing enough and we feel like we need to know more or be more, and a lot of times we are right where we need to be. And the biggest thing that I would say within the first like couple weeks as a student going into your clinicals, and this can apply to physical therapy, this can apply to nursing, just give your best and, you know, ask questions and answer questions even if you don't know that you have the right answer. You know, when your instructor asks you a question or asks you to come up with something, don't say I don't know, and don't say you know, because you do know, you know something, you learned something in school and you have something to give, you have value, you have knowledge, and if it's if it's wrong, then they will give you feedback and help you learn from that. But don't be afraid to be wrong, because you're going to make mistakes. You're going to be wrong sometimes. Sometimes you're not going to know what to do. But the worst answer you can give back to your instructor is I don't know, and not even attempt to give an answer or not even attempt to try with a patient. You know, if they ask you, do you want to work with this patient? Like, take on that opportunity, even if it's scary. They're going to help you. They're right there. They're going to help you through it and help you come up with strategies. But if you don't even take that opportunity to get outside your comfort zone of where you feel like you are right now and pushing yourself to, you know, a higher level of being a student, then you're never going to get to that level, because you're not challenging yourself and you're not getting outside your comfort zone, because that's where you grow and that's where you learn is outside of where you feel comfortable. And so that is a major thing that I'm trying to do, or that I tried to do over these first 2 weeks is, you know, she asked me like, hey, do you want to see this patient? Yes, you know, and sometimes I was freaking out inside. I was like, I have no idea what to do with them. Like, I feel like I'm repeating the last session. That's a big thing, is I want to come up with new ideas and everything, and it's a balance between, you know, what they've been doing and coming up with new creative ideas, and for a patient that maybe you're not more as familiar with the diagnosis or how they're going to react. So things like that. And so there was a lot of unknowns that I had over the past 2 weeks, but never did I say, no, I can't do that, or no, I don't want to try, you know, because that's what you're saying when you say no, is that you don't want to attempt to challenge yourself. You don't want to try with this patient. And especially for me, I am a couple months away from graduation. Like, I'm going to be out there as a therapist in a couple months. And so I need to be at a place where, you know, I'm going to have patients come in where I'm not going to know exactly what's going on, but I need to develop a plan anyway. And I need to figure out a strategy to be able to help them anyway. And I'm not going to have a clinical instructor right there giving me answers or giving me the help. And so I have to put myself in that position now to challenge myself and to try things and then just see how they turn out and see how it works. And learn from it. So don't be afraid to do that as a student, is put yourself out there, try and take on challenges, and take on the challenges that your clinical instructor gives you, and don't say I don't know. Just give an answer and try and, you know, answer to the best of your ability. You're gonna learn from it and you're gonna make mistakes. So that's my biggest advice to any students that are watching this, that are going into clinical rotations, is that maybe your first 2 weeks are going to be messy and you feel like you don't know anything and you're freaking out inside, but just relax and breathe and remember that you know something. You're not going to know everything. You're not going to be perfect, but you know, you have to push yourself and you have to get outside your comfort zone, and that's going to help you be an awesome clinician and just an awesome human for these patients and clients that are coming in to see you. My last little note about this clinical rotation is that safety is a way bigger focus in this population, with people who are unsteady on their feet and don't have balance. And, you know, I'm always using a belt. It's called a gait belt for those of you that have never used one, but to hang on to them when I'm walking with patients, or, you know, so just keeping that in mind is, you know, very different from the last setting I was in, where safety as far as like, are they going to fall, was not really an issue. So I never was using a belt on someone, where a lot of my patients now, I challenge them to do anything. I have a belt and I have my hand at least right there ready to grab on if they go down. So that is, you know, a big switch for me, is like I always have to be hyper aware of the safety of my patient. which is a good thing, but it's just something to adjust to and something that I always need to keep in mind. So overall, my first 2 weeks went very well. It's been a good experience so far, and I have 7 more weeks, and so I'm just getting started. But I've already created a good relationship with my instructor, and I like the people that I work with, and I've already set up opportunities to shadow other disciplines like occupational therapy, speech therapy, and all of that. So I really think that this is going to be an awesome experience. I still miss home. I know I'm only 5.5 hours away, but after being home for a week after my last clinical, it was kind of like a tease. And so now being away and being on my own, as much as I am a very independent person and I'm okay with being alone, I still miss my family and all of that. So, but it's been a good experience so far, and I'm excited for the next 7 weeks and how I'm going to grow as a person and grow as a clinician within this clinical experience before I go on to my last one. So there you have it, everybody. There is my first 2-week reflection on this clinical experience. So you can always message me if you have any questions, whether you're a student, a therapist, or just a random person watching this video who's excited to work with me when I officially have my degree. You can message me, email me, comment below if you have any questions, comments, concerns, anything like that. I'm always happy to talk further in detail about anything that I share on my page. So thank you guys for taking the time to watch this and following along with my journey. I can't wait to share the rest of the process with you. I will talk to you guys later.